Good afternoon, everybody. I'm Ian McLean, Director of Clinical Radiology. I'd like to welcome everybody today to our induction ceremony. This is a very special occasion for us all, and particularly for your future patients. This ceremony signifies the very hard work, your dedication that you students have done in your pre-chiropractic and your chiropractic academic work. Today, we welcome you to the clinical education portion of your time here at Parkman College. Your mentors, on the left side, are here to welcome you to the clinics. Please stand so everybody can recognize you. Thank you. Thank you very much. These doctors of chiropractic are here to guide you through your clinical education and to prepare you for your future in the profession. We look forward to watching you progress. Faculty, you may be seated. Currently you are. It is my honor to welcome to the podium Dr. Spencer Lindholm, one of our faculty members. Dr. Lindholm graduated from Parkman College in 2016 and is currently a faculty instructor within the Diagnosis and Radiology Department. After graduation, Dr. Lindholm started a sports chiropractic clinic in Denver, Colorado, which he operated for 6 years before deciding to come back here and teach at Parkman College. He has extensive training and continuing education in the area of functional assessment, manual therapies, and sports chiropractic. In addition to patient care and teaching, he enjoys contributing to the chiropractic literature and leading continuing education seminars for practicing chiropractors and students. Dr. Lindholm, as you'll notice, is passionate about educating the next generation of chiropractors to deliver exceptional, evidence-informed, and patient-centered chiropractic care. Dr. Lindholm.
All right, good afternoon, family, friends, esteemed colleagues, and students. We just saw each other yesterday in lecture, so if you're not familiar, they've had the last year, 3 trimesters of me teaching them in class. So they're probably like, come on, speed it up, let's get to this white coat thing, right? But with that being said, I'm very honored to be here today. I think I've gotten to gather a pretty close relationship with a lot of them. I've got to see them flourish from coming out of their life sciences courses a year ago to really having this great clinical understanding that's preparing them to go in and see patients. I'm honored to be able to say some words here that I think will really help celebrate this accomplishment and really this ceremonious occasion of them going from that classroom setting to clinical care and actually seeing patients beginning just next trimester. I know how hard all of you have worked on this. Today I want to share 3 lessons with you, or pieces of advice that I've gathered over the years of treating patients and being in this profession. The first lesson is so simple, yet it's one of the best pieces of advice I can give you all. Listen to your patients. This doesn't mean simply checking off boxes or a list of questions on a form, or feverishly jotting down those answers, but really, truly listening to your patients. One of the pillars of patient-centered care is patient experience and patient preference, which means making a genuine effort to understand what this person's values and expectations are. This serves as the hallmark of building a therapeutic alliance in which they are as invested in their care as you are. I want to share a story with you about one of the first times that I learned this impactful lesson. During one of my first appointments as a student going into clinic, just as you will be next trimester, I was given a not so gentle reminder on the many reasons to listen to your patients. So typically, for those that aren't familiar, upper trimester students will tend to pass down patients as they're transitioning out of the clinic system. And so I was passed down a patient, we'll call her Patty. She was a gal in her 70s, very nice lady, and she traditionally received activator care. If you don't know what an activator is, it's an instrument you can use to help perform an adjustment. And I decided that I was going to talk to Patty and tell her, you know what, I think I know better, right? We probably need to do a side posture adjustment here, a nice manual adjustment. So, without listening to Patty, I tried to talk her into it, and she reluctantly relied on my expertise as this new student intern to do what I thought was best. Well, I gave Patty a somewhat nervous, but I think pretty proficient side posture adjustment. And what do you think happened? Patty got what you would call a case of flatulence. Right? Patty had a little bit of an issue with that side posture adjustment. Needless to say, Patty was mortified. I was super embarrassed because I had, felt like I talked Patty into actually doing this type of treatment, and an activator adjustment would be much more gentle probably and aligning with her patient preference. So needless to say, right, there's some embarrassment there, but with that being said is, listen to your patients, listen to their preferences, listen to what they want to get out of care, and with that, treat the person of the patient, right? Don't just treat the patient, don't just treat the diagnosis. The next lesson that I would like to share with you is a clinical pearl that hopefully will free you of much stress and internal debate that you may feel when you get into that treatment room with the patient. Embrace uncertainty. In healthcare, there is an obsession with finding the right answer at the risk of oversimplifying the richly iterative and evolutionary nature of clinical care. It is this very antithesis of humanistic, individualistic, patient-centered care. Think hypothesis rather than firm diagnosis. Contemporary clinical reasoning involves optionality rather than being a single right answer, and an appreciation of the patient's values. Embracing the grayscale aspects of human health and illness, aspects that cannot be neatly categorized, and encouraging curiosity to explore the capacity to sit comfortably with that uncertainty, acknowledging that certainty is not always the end goal. The responsibility of solving problems and helping the person in front of you in that treatment room can feel like a lot at times. But just remember, pressure is a privilege, and you've earned that privilege now to be in that room with that patient. Which brings me to my third lesson. When you're feeling the pressure, or when you feel like you're struggling to keep your head above water in clinic, ask for help. You can't see the entire picture if you're stuck inside the frame. If you're in clinic, you've got a lot of resources around you. You've got these amazing staff docs that you get assigned to. You've got your peers that you can bounce things off of. Get every piece of knowledge, tip, and trick that you can out of these staff docs. Not only the doc that you're assigned to, but everyone in there, right? Get every piece of knowledge you can, because these are invaluable advice and lessons that they can teach you individually, but collectively, as a whole, they have a wealth of knowledge that you're not going to find elsewhere once you're out in practice. You'll never be in this environment again. In a little over a year, you will be graduated and seeing patients on your own out in your communities. Make the most of this opportunity while it's here and work your tail off. Commit to becoming at least 1% better every day during the rest of your journey here at Palmer. If you try to make each day better than the last, you'll undoubtedly flourish into a great doctor. Don't just meet the minimum requirements. I mean, meet the minimum requirements. Like, we want to see you graduate, but don't just meet the minimum requirements. Do the hard things. Complacency does not lead to greatness. If you do what is easy, your life will be hard. But if you do what is hard, your life will be easy. It's hard to show up every day and give 100% in every patient visit, but that is your responsibility, that is your obligation, and your patients deserve that. Just remember, every great chiropractor started exactly where you did, in a lecture hall at Palmer, and they went through this exact step, the clinic induction ceremony or white coat ceremony. What separates you from those great chiropractors? Absolutely nothing but hard work. What separates you from them is something that you need to put in every single day when you're seeing patients. Just because something is attainable doesn't mean that it's easy. It's hard to treat the person and not the diagnosis. If you treat a diagnosis, you win some, you lose some. But if you treat a person, you'll win no matter the outcome. For people that are running toward their dreams, life has a special kind of meaning. Your work is going to fill a large part of your life, and the only way to be truly satisfied is to do what you believe is great work. And the only way to do great work is do what you love. This ceremonial and important step in your journey signifies the privilege bestowed upon you to deliver exceptional chiropractic care. Congratulations on this momentous milestone. Now go forth and serve. Thank you.
I hope you were listening. That was fantastic. Very much appreciate that. And now I'd like to introduce Dr. Michael Tuning, our academic dean. You have all met him before. He's helped lead you through your extremely rigorous academic program. Dr. Tuning.
Thank you. And first, I'd like to thank all the families and friends and your attendance today and your support of these students over the last 6 trimesters. This is a challenging program, stretches our students, creates the chiropractors they will become, but that happens with the support of family and a good, strong support network, so thank you for that. To the class, today, this is much more than just a symbolic ceremony signifying a change in your learning experience. What we're doing today is an absolute necessary change in your perspective as a chiropractor. What matters most, all right? And what matters most. For the first 6 trimesters that you've been here, what matters most has been what you've covered in your life sciences courses, diagnosis, radiology. What's important for the test? What's important for the quiz? What do I need to do for this particular practical? You spent long nights studying all those concepts, working together, quizzing each other, testing your setups, making sure everything's just right. As you progress through this next clinical phase, know that there will be times of frustration, anxiety, self-doubt, just as you probably had through the academic portion. But the people assembled here today, your support network, faculty, staff, and of course your colleagues, are all important resources for you to use to work your way through this curriculum. Good luck to you. You've earned it. You're ready to go. Thank you. I would now like to introduce Dr. Kara Shannon, our Associate Dean of Clinics.
Hello, everybody. Thank you, Dr. Tierney. My name is Dr. Kara Shannon. I am one of the Associate Dean of Clinics. Today, we'd like to honor and welcome you, the students, to the next step in their chiropractic education with this induction ceremony. Students, we know that you are sufficiently prepared to join us in the clinic and share your knowledge, passion, skills with patients and our community. Over the next year, we will watch you transform amazingly, and we will meet back here in just a little over a year for graduation. The journey that lies before you is exciting, but at times may feel like a whirlwind. So please know that we support you every step of the way, and we are here to help in any way that we can. The time has now come to formally induct the students into the clinic, but there are some procedural items to go over first. So when presented, the students will come to the side podium over here, where they will be introduced by Ms. Tara Scholes, who is our Senior Director of Clinic Operations. And Dr. Pavlicek, my fellow Associate Dean of Clinics, will be assisting students with the cloaking of their white coat. The white coat in healthcare signifies purity, professionalism, and clinical knowledge. The students will present at the center stage behind me to meet me with their badge to be attached to their coat to signify the induction into the Palmer Clinic system and to start their clinical education. Students will move to the backdrop right here for a picture to be taken by the college photographer. Students will then exit the stage where Dr. Callan Dittmar, faculty clinician and clinical methods instructor, will be presenting interns with a token of our appreciation for their hard work to get to this day. Dr. Jering, Director of Rehab Services, please present Class 243 to their induction into the clinics. Thank you.
Caitlin Andreessen. Eric Arthur. Ryan Bachman. Sage Banfield. Dylan Beanie. Nicholas Beasley. Matthew Beckman. James Bromwell. Savannah Brox. Stephen Buchanan. Stefan Cherry. Nicole Coventry. Destiny Decker. Joshua Dowling. May Duba. Zach Duckworth. Caitlin Eastburn. Troy Fields. Bryce Fisher. Allison Fleming. Sage Freed. Brendan Geis. Luke Gilbert. Jeremy Gonzalez. Sydney Grainer. Mariah Graw. Josie Green. Thomas Guerin. Will Gazinski. John Haley. Celeste Buck. Caitlin Hellman. Amy Henry. Cameron Inselman. Jared Jackson. Madison Jumper. Garner Casa. Sebastian Calm. Olivia Kasprick. Emily Keller. Brandon Keys. Zoe Klein. Taylor Cliffman. Carter Connect. Madison Kress. Kelsey Creer. Patrick Creer. Dimitro Kubrak. Jacob Quast. Darcy Lang. Ava Langford. Seth Link. Samuel Linner. Nicholas Martinez Jr. Megan Meyer. Lauren Meisel. Caitlin Mendini. Blake Molis. Jacob Nelson. Keely Nelson. Alyssa Altman. Danielle Pattison. Ethan Pottebaum. Juan Riviera. Cassidy Rourke. Madison Scarlacera. Jared Schulte. Caitlin Schultes. Allie Siegert. Ben Saburowitz. Jordan Soto. Elise Splico. Brandon Swans. Kaito Takamura. Ryan Thomas. Brianna Tilton. Parker Traub. Shelby Van Gelderen. Ana Rosa Vargas Hernandez. Cole Verbrugge. Alex Wallace. Madeline Webb. Tyler Weber. Jessica Worley. London Whitmer. Peter Wormer. Latien Wu.
Okay, first and foremost, I'd like to thank the student families and friends for being here on this important day. I know you've supported all our students, whether it was a phone call of encouragement, visits, a check or two, it's greatly appreciated by our students. As the ceremony concludes, there's a cake reception. Yes, we said cake twice. For everyone down one floor in the Gothic room, where you entered today. A class photo will be taken, and all pictures are recorded of the ceremony will be posted next week and are free to use. Before we take a class picture, class 243, please stand and present yourself to the audience. All right, students, go ahead and have a seat. So here are our instructions for the day. I need the first row of students to bring your chairs and put them up here on this first row. After that, I am not in charge anymore. We'll get going from there. So after the pictures are taken, please meet your students downstairs in the Gothic room. When we're done with the picture, the time is yours. Again, congratulations, students. Thank you for your time, and to be quite honest, welcome to the clinic. Have a good day. Thanks.